response to the COVID pandemic, there's a lot of uncertainty from patients about how they can continue their MS care. In response to this, we are now offering electronic visits with healthcare providers. It's very simple to set up. You can either send a message to your provider through the patient portal, or you can contact the administrative assistant to help you arrange this visit. You would just need to have a smartphone, tablet, or camera-enabled computer. If you do not have this technology, we are also offering telephone visits to limit the need for patients to come into the center. There are many concerns from patients about how to contact their providers, whether it be needing a prescription refill or clinical questions. You can do this by accessing and signing up for the MedStar patient portal. There will be a link down at the bottom. It's fairly simple. You'll need your name, date of birth, and some other identifying information. If you do have a medical emergency, this is not the outlet for this. You should call 911 or go to your local ER for a medical emergency. It generally takes about 1 to 2 business days to receive a response for your portal request. A lot of patients are concerned about their risk for contracting the COVID virus. Although there's a lot that we do not currently understand, we don't believe at this time that our MS patients have an increased risk for contracting COVID-19, or that if they are to contract the virus, that they would have a more difficult course. Keeping that in mind, everything in MS is very individualized, so there are some medications that patients are on, or if they have another underlying medical issue that might increase the risk slightly. So this is a conversation really to have with your healthcare provider. You can certainly set up an e-visit or a telephone visit through the MedStar patient portal. Another frequent question that we're getting from patients is what to do regarding their MS therapies. Although there still is a lot of uncertainty and unanswered questions, the MS community is actively gathering data and watching the situation very closely. So at this time, the consensus is to continue your MS therapy. If there are any specific concerns, please contact your provider. So another frequent question we've received is how to handle routine lab work and MRIs. Should patients continue to get these tests done? In order to minimize exposure in healthcare facilities, we are having some patients delay their routine lab work and diagnostic testing. But in many cases, there is an urgent need. So if you have active symptoms, there's concern for a flare, we are recommending. So this is really another case by case. And if you have questions, please send a portal message and reach out to your healthcare provider. If you are having new or worsening symptoms, it's important that you reach out to your healthcare provider. You can do so through the MedStar patient portal. At that point, your provider can determine whether or not you need an electronic visit or if it's urgent enough for you to come into the office to be seen. If you think you may have been exposed to COVID, or you think that you are developing or exhibiting symptoms of COVID, it can be very anxiety provoking, but we do have a very robust system here in place for patients. There is a 24/7 MedStar e-visit that you can connect with a provider to have screening. If necessary, they will send you for testing. Again, if you are experiencing a medical emergency such as shortness of breath, chest pain, you need to go to an emergency room or call 911. And something to keep in mind is if you do get screened or triaged, tested for COVID, it's important to report that information back to your MS provider. The Georgetown Multiple Sclerosis and Neuroimmunology Center is currently accepting new patients. Due to the outbreak, though, these visits will take place electronically. As soon as the pandemic has died down, we will be able to offer in-clinic visits at that time. So when trying to find out more information about COVID and MS, it is important to go to a reliable source of information. We are recommending that patients go to the National Multiple Sclerosis Society website for any information regarding COVID and MS. Although these are uncertain times during the COVID-19 pandemic, we want to reiterate to our patients that here at MedStar Georgetown Multiple Sclerosis and Neuroimmunology Center, we are here to help guide you through this pandemic. So certainly, please feel free to reach out to us, and we look forward to continuing your care.